Clue us in, what can I do for you?
Lower back pain, coccyx in particular.
Coccyx. Okay, and how long have you been dealing with that?
About 3 to 4 months.
3 to 4 months, okay. And what have you been doing to take care of it?
I've been trying to walk a bit or sit in a cushion chair, special for the coccyx, but it's not really doing much.
Oh, even the seat cushions doesn't help for you? No, I got it. And also, what else have you been having trouble with it?
My hip opening and my shoulder as well.
Got it. All right. So what we're going to do is this. We're going to take a closer look, see what's going on for your coccyx pain, also known as coccydynia. We're going to see, how we're going to find it, and also how we're going to correct the problem as well. All right?
Okay.
So I know it's going to be uncomfortable for you, but if you can, take a seat and let's get rolling. Okay. So we're sort of with instrumentation. We're looking for all these potential structures that are damaged. And the byproduct of that damage is inflammation, which will give off another heat, swelling, just like what we see over here. This is not body fat whatsoever. This thing is swollen like crazy. All right, so clearly the body trying to protect something here. So when we scan it with this instrument, we're going to see that reading right there. And I believe we did. Right in the bit back. So I just discussed earlier, we see this is all puffy over here. This is not body fat whatsoever. This is all swollen. Just try to stabilize, protect something here. So clearly there's something damaged here. We're gonna take a closer look, see what's going on. So yeah, I feel this huge speed bump right over here. Right, you feel that?
Yeah.
Yeah, right. Tender?
Yes.
Yeah. How about this fellow over here?
Yeah.
Yep. How about this fellow?
A little less.
A little bit less. Then we'll check a little lower. How's these fellows here? Not too bad?
Not too bad.
Not too bad, huh?
No.
Now, we just checked the coccyx right now. No tenderness there.
No.
No. But when we move up to the 2S, tender right there, huh?
Yeah.
Yeah. All right. Let's check everything else. Oh, this was swelling over here too. Tender right there?
Yeah.
Yeah. How's this fellow over here?
Okay.
Not too bad?
Not too bad.
It is swollen right over here. It's swollen on this side too. How's this fellow here?
That side's a little worse.
Yeah. So when we check it, how's that fellow?
Yeah.
Yep, we found it. Okay. See, now we do have a partial fixation. It's not fully stuck. See, I could somewhat tilt your head to the right.
Yeah.
So your head can easily tilt to the left.
Yeah.
Somewhat stuck on the right.
Yeah.
So even though the atlas may be partially fixated, it's not a true subluxation. It's only halfway. So that tells us that no, we're not going to be touching that fellow. So when we do our job, correcting everything in your spine, the foundation, your mid-back, and your fifth cervical over here, this atlas should disappear and self-resolve all by itself. So that could help explain why you get from time to time the migraine headaches over here, because the way your spine is being knocked out, you could put a little pressure and irritate the nerves, goes on those migraines. All right, let's take a look, see what's going on. So here's a story with your case. Now the coccyx itself, well, yes, it is bent inwards, all right? I see that more likelihood of being an old childhood injury. Most likely when you're a little baby, what have you, and which is very common. Babies do fall on their butts quite often enough, but they may not get in there. Now here's the thing. Most coccydynia cases I've seen in here are usually misdiagnosed and usually a sacral problem. So what I mean by is this. Right on this model, this is the coccyx itself. All right, there's these 3 segments over here. Now, just like we checked it on you on the examination, we tested it, and also even though the x-ray shows that, yes, this coccyx over here, it may be bent way inwards, we tested it, it's not symptomatic. Now, am I actually going to try to realign that? The answer is no. That's old saying goes, if it ain't broke, don't fix it. So even though it may look bad, but here's the thing, your body has adapted and healed in that position. If I try to realign it, right, we're going to open a huge can of worms. You're not going to like it. But instead, what we tested confirmed on you was this 2S segment right over here. It is connected to the left hip and also the right hip. That could explain why every time you try walking or running or what have you, or even doing the yoga, it just didn't like that at all, right? And you may notice that walking actually feels worse than standing, right? So here's the thing. Every time when you sit down, right? Here's the thing though. Every time we sit down, right? We're supposed to sit on these sitting cushions over here. Okay, the sitting bones over here, ish tubes. Now, because the way the coccyx is and the sacrum and the cushions these days, that's why we usually recommend a coccyx seat cushion. When you have a coccyx seat cushion, there's a cutout and the coccyx should float in there without touching anything. However, because the way seat cushions are, okay, if we sit upright, the coccyx and the sacrum, it doesn't touch whatsoever. So going back to this over here on the seat, if you can see over here, right, just by putting, just like even sitting upright, we still see a little pressure on the coccyx and the sacrum itself. So having a seat cushion will help a bit. But here's the other component too. Most people, what do? They usually don't sit completely upright. They have a tendency to slouch. So when we slouch, just like we see over here, it puts a lot of pressure on this bottom part of the sacrum, and it's going to irritate this 2S even more, aggravating a lot more itself. So that's why it's very, very key and important not only to sit upright, but also get that coccyx seat cushion to allow this fellow to heal up properly after we correct it. Now, by nature, the way this 2S went out, yours went out this way, backwards. So every time you sit on it, it's going to keep on aggravating, keep on going like this. And that's why it just doesn't feel fun when you sit on it every single time. Now, other component is also, it went backwards and it rotated this way as well. So, on today's visit, what we're going to do is we're going to realign it this way. Right? Let's rock and roll. There it is. Come on up, please. Okay, walk around.
I mean, it feels a lot less pressure. It felt a lot of pressure before. It feels a lot more relief now.
Okay. What other things do you notice?
I'm standing up straighter.
Standing straight. That's good. Okay. Want to give it a try?
Yeah.
Okay.
Oh wow.
Oh wow, what?
There's not a lot of pressure in my lower back anymore.
How much of it has been reduced, would you say?
I mean, at least 80%.
80% reduction?
Yeah.
Yeah, great. Okay, let's have you stand up. Don't sit on that thing too long. All right, so here's a story. Okay? Even though, yes, we did find some more things to correct, especially for your neck, because I understand you also had some trouble, turning your neck around, also the migraine headaches. The key concept I want you to understand is this. We need to have a stable foundation. If the foundation is stable, so is the rest of your spine. And if it's not, everything else on top of it is going to collapse like a house of cards. So while, yes, we did identify some potential areas for the mid-back, lower part of your neck, and also some fixation on the top part of your neck, I'm not going to try to disturb any of the stuff because right now we just realigned your foundation. I need that thing to heal up. It usually takes about 2 to 4 weeks for the bones to bond nice and strong in that area, right? Let's double check, see what's going on with your mid back and your neck right now. Feel that difference now?
Yeah.
Right? It's a lot more looser, right? Not as stuck as before. All right, scoot forward. Actually, there's another thing too. How do you like that? See this? I don't know if you viewers can see this. The puffiness all around the left side has already drained out. You still have quite a bit of puffiness in the middle part. See, the right side starts to drain out. You still have some over here. So what I want you to do is this. I want you to ice this over here, 20 minutes, 3 times a day. And then we'll take another look at the next visit, see how that fellow heals up. Now, next part. See, how does that neck feel right now?
A lot better.
Okay, so try to turn your head, see how that feels.
Still some pinching, but much. I can go back a lot more than I was able to before.
Okay, how much more better would you say?
At least 60-70%.
Yeah, we didn't correct anything else,
Yeah.
right? That's why it's that important to have the correct foundation, right? Now let's check the atlas itself. You feel how much more you could tilt to the right?
Yeah.
Now you still do have some fixation there, but it's very, very minor. But yeah, in the future visit, we'll keep an eye on this fifth cervical, see if it needs to be corrected. Same thing with your mid back. Most likely it will do, but we'll do that after we see that foundation nice and strong and stabilized. All right? So that's going to be your homework. Don't forget to ice that fella, right? And oh, it helps to stand up. Don't sit too long on that fellow over there. Okay, so once again, that fellow is swollen, right? So it's going to be key and imperative. You're going to ice it down 20 minutes, 3 times a day. But actually, I stand corrected. Considering how badly swollen that is, I would recommend every 2 hours. And considering your line of work, you're sitting at the computer desk all day long, 12 hours plus. Yeah, you definitely got to get that Coccyx seat cushion, all right? And do it every 2 hours. I know it's tough at work, but we're gonna make it happen. Pump all that fluid out of the way.
Okay.
All right? All right, that's it for today. You're very welcome. I'll see you next visit. All right, Jan, so bring us the latest updates.
It's feeling much better. It's a little bit tender now. Right after we had the last adjustments, it was perfect, and I've been icing it, so I've been keeping pretty well. It's still a little bit sore.
Well, that's understandable. Okay. All right, so how long can you sit now these days?
Much longer. I can probably be sitting for 2 hours. It becomes a little bit uncomfortable at that point, but that icing helps.
Great. All right, let's take a look, see what we got. So let's take a look, see what we got for today. Slight little reading over there. And a slight little reading over here as well. It's 1 point. All right, so the pooling has went down quite a bit.
Yeah.
We like that. You still have some swelling over here. We'll check this fellow over here. Hey, how do you like that? Yeah, the speed bump here, it's not as prominent as before.
Yeah. I noticed that as well.
Yeah. And on top of that, this is also, we have proper full motion on this one. We don't have any fixation here. Okay, so here's the story right now. Based on what we found so far, instrumentation shows not a significant reading. The swelling has gone down significant as well, which is another indicator. Not much muscle spasms, another indicator as well. So all these data is pointing out and telling us, no, that fella is still healing. No different from like when we get a cut on ourselves, what does the body do? It forms a clot. Do we start playing around with it, or do we let it heal up?
Yeah.
We gotta let it heal up, right? So that's why we're not gonna adjust that fella today.
Okay.
All right. So today's gonna be a checkup. That fella's still healing. Continue icing on it 20 minutes every 2 hours, and we'll see you in the next visit.
Okay.
All right?
Great.
Okay. It's been a pleasure. See you next time.
Thank you.
Give us the latest updates. How are things?
I've noticed a lot less swelling.
Mm-hmm.
I have been, before I was icing it every 2 hours, now every 4 hours is okay. There's not that much swelling. The coccyx itself is still a little bit sensitive, but I can sit for 4 or 5 hours without feeling anything. So
That's great. That's great. So how much of an improvement would you notice since the last time?
since last week, probably 40% improvement, but from the first time, 80%.
80%.
Yeah.
Hey, that's great. All right, let's take a look, see what we got. Yeah, this is looking pretty good there, actually. Side reading there. Okay, so you can see to the viewers over here, we still have puffiness here. This is still swollen over here. So now we're going to test it. Hey, speed bump is almost gone. See that tiny little ridge there? That's all it is. Very tiny. Yeah, it's still healing. Right there. All right. All right, champ. So it's the same story as the last visit. This fella is still healing. You're doing great progress over there. Keep icing. We're doing what you're doing. All right. And we'll see you next time.
Okay. Thank
All
you.
right. Oh, you're welcome. Okay, so it's been 4 weeks. Give us the latest updates. How's everything been holding up?
Everything is good. Doesn't hurt anymore. My lower back's not really inflamed that much anymore. My coccyx still hurts a little bit, but only when I sit for extended periods of time, more than 4 hours.
So it holds up until 4 hours.
Yeah.
Yeah, that's pretty great progress.
Yeah.
All right, let's take a look, see what's going on. Oh, how do you like that? We finally got a reading here. So it held up for 4 weeks. That's great. Still got some swelling over here. A lot better than before, but this is starting to swell up a bit. How is that, fella?
Still sensitive, yeah.
Sensitive, right? And we need a tune-up on that, fella. Let's rock and roll. Perfect. Try to buy a little more. There we go. Okay, come on up. Walk around, please. Okay, so pull us in. What's different?
It feels more relief, that's for sure.
All right.
Yeah, I don't know. I feel more mobile. I don't know, like in my hip area.
Yeah, perfect. So that's what the story is for that foundation. So it looks like you're gonna need a periodic tune-up. Make sure that fella heals up in proper place every 4 weeks or so. It usually takes about a good 4 to 6 months or so to make sure that fella stays put. All right, so we'll see you next month.
Okay.
All right, have a good one.
Thank